decision. Rise up, make that decision. God will provide all your needs. He wants you to succeed. Have faith of a mustard seed. Get up on your feet. Rise up.
Welcome to another segment of the Drexwell SEMA show. Today, this show is very personal to me because we're going to be talking about panic attacks, what you need to know. And the reason it's personal is because I experienced panic attacks about 3 or 4 times now while traveling on an airplane, about 3 times while being on dialysis, and then an evening before I had a minor surgery. Of course, I didn't know it was panic attacks. What I did, based on the symptoms that I experienced, I diagnosed myself that it was panic attacks, and I'm convinced that's what it was. And a lot of people perhaps are going through this and don't know what it is that they're experiencing. And I thought it'd be fitting to, have this topic on my channel. And so I have invited Dr. Prince from the Department of Mental Health and Substance Dependence to discuss this topic. I think that needs to be as an educational format for many of us. And so with that said, I really appreciate the opportunity to have Dr. Prince on the show. And I want to thank him for giving me the time to give me the opportunity for him to be on this show. And before we get into the meat of the conversation, I would appreciate if Dr. Prince, could tell the viewers about himself.
Thank you, Mr. Seymour, and it's really indeed a great honor to be on the show with you, and for many reasons. One, I've seen your progress from where you came from since I came at the end of 2004 to where you are, what you have done in terms of helping to develop the country and your society, and the contribution you have made over the years, both professionally and personally. So it's really indeed a pleasure to be on the show with you. As for me, I am Dr. Patrick Prince, as Mr. Seymour introduced, and I am from the Federation of St. Kitts and Nevis, and I've been in Turks and Caicos Islands since the end of 2004 to date, going strong, and continue to work with the Turks and Caicos Islands government and its people, and doing whatever I can, going above and beyond as always to help those in need. And so I want to say thank you. And it's indeed a pleasure to be here and to also continuously working with the people and the residency of Turks and Caicos Islands. So thanks again for having me.
Well, thank you too, and thank you for your contribution that you've been making and are making to the Turks and Caicos Islands over the past almost 18 years. Thank you again.
You're most welcome, sir.
So, Dr. Prince, we are going to go straight to the topic. What is the meaning of panic attacks?
Okay, when we talk about panic attacks, many times we single out panic attacks, or sometimes we will say anxiety attack. But they're one of the same, but yet different. And panic attacks, as we have it, is really one of 4 of the anxiety disorders because they're classified. And so panic attacks, many times persons would use the word panic attacks and panic disorder as being interchangeable, but they are one of the same, but still slightly different.
Okay.
So it's almost like panic attacks is the son of panic disorder, okay? All right, but they are all in the same family. So panic attacks are sudden episodes of intense fear that are usually triggered and a person starts experiencing, the physiological, emotional, and psychological intense feelings of danger, whether it be real or perceived. So even when you talk about when you're on the airplane, or when you're at the airport, or when you're doing dialysis, or when you're home, whatever it may be, panic attacks they can be very frightening.
Yes.
And the thing about panic attack is that once a person is triggered to have one, they feel out of control. So they feel like, oh my God, what's happening to me? Why is my heart beating so much? Am I going to die? Is my chest going to explode? Because these are some of the experiences, the physiological manifestation of a triggered panic attack. And of course, I can say this, but when a person is experiencing a panic attack, they may not feel what I'm about to say, which is it is not life-threatening. Okay?
It feels that way.
Exactly. That's what I'm saying. It feels like, but I'm also saying it is not life-threatening. It can be frightening, and it can definitely affect a person's life as they know it, as well as their lifestyle. However, believe it or not, many persons have had one or more and may have one or more in the entire lifestyle, in the lifetime. Okay. For many, it happens, then it goes away, even without their trying. But for others, it's continual.
Right.
All right. However, I started out saying that panic attacks are the son of panic disorder, if we were to look at it in that context. Because the persons who would have one or two and it goes away, those are just classified as panic attacks. But once the attacks keep persisting, once they continue, then it's no longer panic attack. It is now classified as panic disorder.
Oh.
Okay, right. So it would have evolved if an intervention is not done earlier. Okay.
Okay.
Right.
And so that goes my next question.
Yes, go ahead.
My next question, what are the symptoms?
All right. When it comes to symptoms of panic attack, I want to give somewhat of an overview so persons can realize what they really are and not just highlight a checklist.
Okay.
All right. So typically, there is initially no warning. And so, for example, I've had persons coming to see me, they were driving to work. And while they're driving, they feel this overwhelming sense of doom, like they're going to die.
Yeah.
They start sweating, they start being ultra nervous. In some cases, they have to pull over quickly or stop the car suddenly. Okay? And of course, luckily for those persons, nothing had happened at that point in time. However, because of that, persons usually reach out. And there are very different ways a panic attack is triggered. So there are myriad of expressions of and feelings of panic attack. And so I just want to highlight some. These are not all, but these are the more common ones.
Got it.
And sometimes it's not just one, but it's also a mixture of more than one. So we talk about a sense of pending doom, which I talked earlier, a fear of loss of control, a fear of dying. A person usually have the rapid heart beat, pounding heart, as they say, as if the heart is beating out of their chest. Some of them who don't normally sweat, but really have to exercise hard to even break a sweat, would just start sweating. Okay, and it's almost like someone would have poured water over them. That's how bad some persons started sweating. Then they'll have the trembling, and it's uncontrollable. It's not just a little shake. It is trembling where they cannot control it, almost to the point of having, appear to be having epileptic seizures, because it can go that extreme. Then you also have the sharpness of breath, where a person goes into hyperventilation because they cannot breathe. At least they feel like they cannot breathe, but they can. And that is why sometimes a person can put a paper bag over their mouth or something that has an enclosure to help them slow down their breathing. Okay? And that's the purpose for that, basically. Then you have a person who might have dry mouth. They're going to start clamming up in their throat. So it feels as though, their throat is closing in, but it's not. It's just a feeling. And then some would even have hot flashes. They would want to throw up, if they smell something that they're accustomed to, all of a sudden they could be triggered for them to want to vomit. Abdominal cramping, as if a person just got punched in the gut. Chest pain, headaches, lightheadedness, just name it, imbalance. Sometimes a person can go numb, they cannot feel the extremities, and they'll tell you and feeling themselves, I can't feel my hand, but they are literally feeling their hand. But it's just that feeling that they cannot. And so sometimes, to the extent a person could display and even say things that a person may misinterpret to mean this person might be hallucinating, because to them it's unreal.
Yeah.
Okay. So these are some of the many symptoms of panic attacks.
Yeah. I mean, I know for me it was I fear dying and then I sweat a lot, and and it's very uncomfortable, so I could attest to some of these symptoms. And then my pressure, like the pressure goes down so suddenly, Yeah. What causes panic attack?
There is no single answer where the cause of panic attack is concerned. But based on research over the years, based on assessments done, based on diagnosing, and when we talk about all these, we're talking about doing an entire workup of the person. So not only do we do an assessment, as in, pen and paper assessment, we also do a verbal observation. We talk about a family history. We talk about any challenges they would have had in the past, even as early as childhood. Was there any major trauma? Were there any major accident, major surgeries in the past? There's a whole myriad of things that can trigger. But if I were to class the different ways or the different classes, we're talking about genetics then. We're talking about a major stressful situation. We're talking about a person's personality type, because, they have some of us, there could be chaos outside, and 2 feet away, they can fall asleep, pass out, they're not bothered. While someone right next to them, they're freaking out. So a person's temperament is important. And then, of course, because of our brain, some of us inherit, and this is where genetics comes in again, family history, where our brain sometimes is rewired, reset based on hormones, based on a myriad of things, our environment, what we are thinking, what we do, what we eat, what we use, abuse. So many things can trigger where the brain is concerned. Because sometimes the brain has anomalies. Some of us are born with brain defects, inherited from our parents, they inherited from their parents, and it goes all the way back generations. But sometimes these things lay dormant. And so all it needs is a trigger, whatever that trigger may be. For some, it's going on an airplane. I recall, for example, back in 2005, when we had the loss of lives in South Caicos, which you're from, I understand.
Yes, with the airplane crash. Yeah.
Right, exactly. And of course, I had to go because I was then the only mental health practitioner here. And so, my job was to go where the needs are. So I was based in Grand Turk from 2004 until 2009. So I went to South Caicos. And for me, because a plane crash doesn't mean I would not go. I went. Was I fearful? No. Again, because of how I am and my temperament. However, there was there were persons on the plane that were going to South, and there was one specific gentleman who was boarding the flight. Okay, and this now was Sky King, because you know it's back then. It was Sky King, and as soon as the gentleman get up to the top of the steps and entered, his feet gave in.
Wow.
So he actually had to be held and helped up into his seat, and he could not move.
Wow.
Now, you would think I'm talking about an elderly person. No, it was a very young, strapped in, very fit, very healthy. And I know that because I know he exercised, I know he works out, I know he had a healthy lifestyle. So none of those were a reason except panic.
Amazing.
Okay? So it manifests itself in many different ways.
Yeah. You're trying to now think, which one of these factors. I have no idea, because I just started experiencing this about, 4 or 5 years ago. Like you say, it could be dormant,
Yes, it can.
Yeah.
It can.
So what are the risk factors?
Okay, when it comes to risk factors, once a person, because earlier I talked about, genetics, predispositions, as in temperament, talk about major stress, talk about brain anomalies, etc.
Yeah.
If there's a family history, and that is why it's important for a person to know about their genetics, know about their family history. So if a person comes from a family that experience panic attacks, panic disorders, or any anxiety attacks, even other mental health challenges, which doesn't even have to be under anxiety. Anyone who has had a mental health related issue, a medically related inheritable issue, major trauma in life, major life stress, whether it be through death of a loved one, serious illness of a loved one, a close to death, situation, smoking, and I didn't say what, because all types of smoking can trigger. And we go back to the brain anomaly again, because most people don't realize once they start smoking marijuana, once they start smoking cigarettes and other, the active ingredients in these substances are in these substances will impact adversely with the brain chemicals and alters it. The problem with that, and this is why many times we as a department reach out, the government reaches out to young people, because I've been doing presentation in primary school since I've come here, high school, college, the public at large, the government entities. And it's always about prevention, education as to why prevention is important, okay? Because once we start using these substances as young people, and research has shown, let me just put a pin and a little extension. In high school surveys that we did here, back in 2006, and 2004 and 2006, it shows in the high school survey of the different farms, persons had already started experimenting with marijuana, alcohol, cigarettes, some cocaine / crack, some prescription medication which they shouldn't have, but they use it because their parents had it, and a mixture of some of these things as early as age 10 and 11, okay? And the majority, of course, were in high school. Now, it's not just for here, because we did a regional study. St. Kitts Nevis did one as well. And it shows the top 3 drugs of choice of first use in this order: alcohol, cigarettes, marijuana. Then the other starts out with solvents and cleaners and inhalants. These are the things like bleach, um, spraying, the things that you clean with. They start experimenting with those. This is why nowadays, but back in my time, they used to use the chalk, the white chalk.
Yeah.
It actually used to be made with some solvents as well. And the students used to go ahead and want to clean the board, because after that, they would inhale the dust from the, okay? And after they did research, they realized they have to stop doing that. So that is why after a while, the chalks could have been broken quicker and quickly, because they were now made with water instead of those solvents. So this is how they start experimenting. But I'm highlighting all that to show and say that once a young person start using before the age of 30, they would have done damage to the chemistry and the physiology of the brain. And those things cannot be undone. Okay? So things like that would cause and can cause someone to have a mental disorder, the triggering of a mental disorder, and especially including panic attacks and panic disorder. So those are where a person's susceptibility comes in as a risk factor. Once there's a history of addiction in a family, a person needs to be mindful that they are prone to that addiction as well. And if used, can cause damage that cannot be undone to the physiology, not just of the brain, but of the body, actually, as well as. And that is why early intervention, early education, and advocacy, that is why they're very important. Because if we can't stop something from happening, it is the key. Even though sometimes we can still help in terms of management, but sometimes prevention is better than cure. But actually, all times,
most times,
yes.
yeah.
Yes.
Wow,
So those are the factors. And look at this, even coffee that we drink, the caffeine, the drinks that have caffeine, even that can trigger. Because as you know, once caffeine gets into the system, it goes into the bloodstream and starts secreting adrenaline and cortisol. That's the trigger. And if we are not in a fight or flight syndrome mode, could you imagine our brain and our body stays in that for an extended period of time?
Yeah.
So why wouldn't we start panicking then? That's the question. We are actually feeding our bodies to panic. So that is why moderation is important.
Yeah.
And that is why I encourage persons, if a person has to use a pick-me-upper, use green tea. Okay? Because green tea, though it has caffeine, the caffeine is not as much as coffee. And then green tea, this is a plus, has L-theanine in it, which is an amino acid that helps to balance out the caffeine that does not allow the heavy impact to hit us, but we end up benefiting because it triggers our brain to function optimally while ensuring that our brain is not decaying and not faulting. Coffee does not
I didn't know that. Okay, I didn't know that.
Most people do not.
Okay.
Okay. But coffee does not have L-theanine, but green tea does.
Okay.
And the green tea is not the one you grow in your backyard, but is the Camellia sinensis, as in the scientific name for it. Yes.
Yeah. Wow, very interesting. I'm looking at this risk factor, and I don't know, maybe to me, it's probably when I started dialysis. I'm trying to remember if I experienced panic attack before I went to dialysis. I think it's after I went to dialysis. So maybe I fall under the category of the life stress, I guess, because those other categories don't suit me at all,
And again, this is not exhaustive.
Right.
These are just a handful of things, of risk factors.
Yeah, true.
But if you have had a family history that deals with any kind of pre-medical conditions, because that within itself is a medical condition.
Yeah.
And that itself can also trigger. Any medical condition can trigger. Just like how when someone, before they go into surgery, they may have a panic situation,
Yeah.
but don't continue after. Some after surgery never suffered depression before, but then suffer depression. Again, because you have these hormonal imbalance at play. And so, of course, depending on how we are, our previous lifestyle to the surgery, to the procedure that we are doing, all these can can contribute to whatever risk factors. So it's best to have, the positives versus the negatives. Okay, so yeah.
Yeah.
As we never know what life might throw at us.
We
We'll do our
don't.
best to have a good lifestyle, but then if there's a curveball, is our lifestyle, has it been making provision for such?
Yeah.
Okay,
True.
so yeah.
True. So I guess later down we'll talk about whether I mean, based on conversation with you were saying that panic attacks can be treated.
Yes, sir.
So what are the complications if it's not treated, if it's untreated?
Okay, if it's untreated, and we go back to one of the things we discussed earlier, which is untreated panic attacks will turn into panic disorder.
Okay.
A person now would have a disorder where they actually may need to be on medication, as well as need to see someone like myself in an ongoing way, just to address triggers. And basically, when we talk more about the treatment, then we'll go into some depth of the discussion. But untreated, just like anything, we start using alcohol, we start smoking, whether it be cigarettes, marijuana, whatever else. If it's a one-off, we get kind of off kilter. If we share the experience with someone and, we get proper guidance, most of us taper off and no big deal. But those of us who continue in this kind of use, then there's a big deal. Because then not only would we get into trouble with the law, we get into trouble with work, our interrelation issues, etc., etc. So, untreated, yes.
Okay. So I know we talk about the symptoms of panic attacks, right? But how do you diagnose panic attacks?
Okay, when it comes to diagnosis, it's very comprehensive. And a lot of times a person may come to me, for example, and they start asking me questions about how can I'm having these challenges, and once they come in, I usually do an assessment. Assessment would include gathering information about family history, giving them a checklist to complete. Sometimes I verbalize it to them, ask them the questions and the answer. In the COVID time, I would, message, email, they'll complete, along with our interaction as well. And once that is done, I would ask them about any kind of pre-existing medical condition that their family would have had that may contribute, which is the risk factor we're talking about just a few minutes ago.
Yeah.
And then I also ask them about things like, when was the last time you did any blood work? When was the last time you saw a medical practitioner for any reason, etc., etc., right? Now, the reason for all that is because I highlighted earlier that some persons have risk factors, and some of it can be triggered at least in 4 broad categories, right? Or causes. Many times, someone who would have used substances can display the same symptoms of a panic attack or anxiety attack, but not having one.
Oh, okay.
Okay? And sometimes the body reacts in a panic attack way as a means of fight or flight syndrome, but they're not really having a panic attack. Okay? But it's the same manifestation. So this is why we have to do comprehensive evaluation
Yeah.
That involves different departments, different professions, professionals, so that we can know for sure. Because just saying a few words is not enough,
Mm.
okay? But it's something to consider while we continue to follow up.
Mhm.
And that is why sometimes a person coming in is not just a one-off. It's an initial interview for us to follow up, look at patterns, because we're talking about treatment, right?
Yeah.
At least, you know, initially, after diagnosis, we have to point to, hey, how do we deal with this now? Okay, so we
Mhm.
have to take all the information and have all these things done. Now, when it comes to criteria, you started out asking me earlier, not too long ago, what happens if these things are left untreated? And then we talk about if untreated, it goes from panic attack to panic
And
disorder.
so, mhm.
All right. So, in a nutshell kind of way, but I'm going to explain that we as mental health professionals, we follow certain international standards and guidelines. Okay. And there's such a book. We classify it as our Bible for this purpose. Okay. Not blaspheming the spiritual Bible, religious Bible, but it is the Diagnostic and Statistical Manual for Mental Disorder, and it's the revision edition 5, the 5th edition. In this, it would give us guidelines and a checklist of what to follow. Out of that, you have a lot of persons who would have come up with a smaller, compressed version of capturing the information that is needed to diagnose. So even when someone comes to me and they tell me that, oh, you know, I have this fast beating heart problem, you know, I feel like I'm going to die. And of course, they start telling me the red flags of a panic disorder, but I just don't take it as is.
Okay.
I would send them something that is called the Beck's Anxiety Inventory. So Beck, Aaron Beck is a well-renowned mental health professional who
Mhm.
has come up over the years with different things. And he's also responsible for the Beck's Depression Inventory, which we commonly use here in TCI
Mhm.
as well.
Mhm.
Because all of these again are done based on the research and also the guidance of the DSM-5, which is the Diagnostic and Statistical Manual for Mental Disorder, as well as the international or the ICD-10, the International Classification of Disease and Other Medical Condition, the revision 10 of it, or the version 10 of it. So with that, once a person would go through and they're having unexpected panic attacks, okay? Once that is done, and if they're having frequent attacks, this is something that we need to say. Now, if a person had, based on a trigger by something, it is not necessarily unexpected per se, but it's a trigger based on something. However, if after a while, nobody's thinking anything,
Mhm.
nothing is happening, but these things keep reoccurring, it's not because the person was using drugs, they're not drinking, they're not smoking, there is no other medical condition. Bam. Then we got to start thinking, okay, it's not because they're afraid to go out in public. It's
Mhm.
not because they're obsessive compulsive. It's not because they're suffering from depression or any other mental health challenges. That is when it's no longer panic attack. Okay?
Okay.
Yeah, it is now crossed over to panic disorder.
Mhm.
And a disorder now is something that needs to be actively and ongoingly treated. And in many cases, there are different avenues that a person can look at, but it has to be dealt with in a comprehensive way.
Mhm. Okay. And so in your last point, you say if panic attacks are untreated, they could get worse. So
Yes,
tell us about the treatment. I mean, so we have established it could be treated. So tell us
yes,
about that.
yes, sir. So when it comes to treatment, a person after doing, the assessment, doing a diagnosis and seeing
Mhm.
where they are, When persons come in to see me, as an example, and I would have done everything that we have discussed so far, like the assessment, getting a family history, talking about their substance use and abuse, their lifestyle, whether or not it's one highly triggered by stress and the type of stress. So for example, most persons who are what is classified as first emergency first responders, right? So the EMTs, for example, you have fire services, you have police, you have the brigades. Now that we have brigades now, right? But whenever there's a trigger for their intervention anywhere, once a person starts living in those kind of stress-related lifestyle, a person also has to be mindful how to deal with those issues because left untreated, they're crossing over in this territory, right? So once all those history would have been done, then the options to talk about treatment would go primarily two ways, okay? And that is psychotherapy with someone like myself, a mental health practitioner. In TCI, we have Dr. Anya Malcolm, who is right next door to me here. We have Dr. Alicia Malcolm, who is our director. She's based in Grand Turk. You have Dr. Dizon. She is based at the hospital. She's our psychiatrist. So you actually have 4 clinicians, okay? Four main clinicians that can deal with from a mental health standpoint. But of course, you have a myriad of medical practitioners here as well, okay? Who have experience with it as well and who have also done their level of intervention. And then now they're sent to us for interventions, for our side of the intervention. So we have psychotherapy and we also have medications, okay?
All right.
Now, when we talk about psychotherapy, we're talking about talk therapy. A lot of people think, oh, but talking about a situation doesn't help, right? But actually, it helps more than people realize. In the time past, you have a lot of persons who used to, instead of going to someone like a pastor then, because many times we didn't have the professional like myself back then. So you had pastors, they won't go to a pastor, they won't go to the doctor because they know what the doctor is going to tell them. You know what they do? They grab a beer, go under the tree and play dominoes, right? And start talking to their friends about it. Now, what could be more therapeutic than that in talking? So they actually have been practicing it, except they were adding other things that would help to trigger. Okay, so the cycle keeps going. So this is where we as professionals help persons to gain insight to break cycles and develop healthier type lifestyle. So one of the main things that we do is the cognitive behavioral therapy. And like the word says, you think, then you behave. You think, then you act. I think, therefore I am. So it's a technique used to help give insights, sometimes ask them to talk about their triggers, talk about their last panic attack, what they felt like. And once they're rehearsing it, we are pointing out, okay, you see, you're reacting this way, you're still behaving this way, but guess what? You're right here in my office.
Yeah.
We start helping them to come to grips that they can control. It doesn't happen overnight for some, actually for none, but it happens faster based on commitment. And this is only half of the aspect, because while this is happening, it's encouraged that these persons also go on medication. Panic attack is a medical condition, okay, that is usually managed by mental health professionals and medical professionals. But most persons think it's one or the other. The quickest way is a combination of both. Okay, so of course they have, go ahead.
Wow, well, I've never had medication. I've never had psychotherapy. Honestly, I just pray. I mean, I've what do you say to that? I've never
Okay,
got treated.
perfect. All right, perfect then. You see, you say you prayed. Whether you prayed openly or you prayed internally, you were talking.
Okay, so that'll come in the talking.
Okay? Okay, so it's a talk therapy. It's just that we as professionals, and that's the key, professionals, right? Not that God is not a professional. Many times a person may think after talking to God through prayer, openly or otherwise, and they keep coming back, they might start blaming themselves and saying, I wonder if I have sinned. My sins are catching up with me, why God is not answering me. Or I wonder if I'm not practicing enough faith. I don't have enough faith and all that. I've heard all that before. But in simple terms, it's none of that. Because as I said, it's a medical condition and it must be treated accordingly. Okay? Prayer is a lifestyle a person can adapt. Many times, mind you, God and medicine are not separate because God introduced medicine.
Yeah, he gives the wisdom to man.
Exactly. Thank you. And this is where a lot of people of faith, our faith organization and institution, don't bridge the gap. Okay, they do not bridge that gap. And many times, some of us, as I indicated earlier, because of our family genetics, inherited the abnormalities that would trigger us to have these medical and mental health conditions. And so because of that, it's out of our control, but with the appropriate guidance, help, and intervention, we are back on track.
Okay.
All good things come from God. Most people forget that.
That's
so
right.
For someone to get help, exactly. For someone to get help, help is not of Satan. Help is not of the devil. It's the opposite. Okay? And we also miss that point where the Bible guides us and say, he who knoweth to do it not is a sin. So if we know that we can get the help we need, but still want to suffer as a result, what can we say?
Interesting. Yeah, interesting. And help comes in many different forms.
It does come in many different forms.
Yeah.
Because as you recall, Saul of Tarsus, which became Paul, God used Paul to help the Israelites. God used Cyrus to fight his battle, and Cyrus was a heathen. God used a donkey, and if God can use a donkey, God can use any one of us.
Yes, he can. Yes, he
exactly. And definitely, I wish I was the donkey God was talking to. I think I'll be more blessed.
Well, I mean, I know we talked earlier about prevention. So can panic attacks be prevented? I know we have different causes and stuff, but can it be prevented?
I want to start by saying there is no way to prevent.
Okay.
Okay. But there are ways to manage. And the reason why there's no way, because there's no definitive cause. And if we don't know the cause, for the trigger of that cause, we cannot prevent it. But we can manage it.
Fair point.
Right. We can manage it in terms of the triggers if we look at the pattern. And that is why coming to someone like us, we will help a person to develop a pattern and to see what usually happens. And then this is where the medication comes in and how the medication is taken. Because many times, and let me just quickly say this before I directly respond to what you ask, because in essence, it's supporting the question you're asking. A lot of times people take medication after the trigger has started, but they had a warning before. It's just that sometimes they did not know. Okay? So I always encourage persons, if you are prone to panic, Then the encouragement is get the medication, which is usually Xanax. That's the trade name. And it's dispensed usually in 2.5 milligrams, small dosage because not much is needed. And I always encourage until you get a handle on it, you take it first thing in the morning so you don't have to worry about facing a panic attack, because that is one of the fear. What if I have another one today?
Yeah.
So let's eliminate that fear while you get help. So take it until you develop the techniques of how to prevent the triggers. And this is where this question comes in, okay? But as soon as a person gets the first panic, they should reach out and start talking to someone. Because as I said to you before, sometimes a person may use substances and they might be triggered as to think that they are having one when actually is the side effects of the substance.
Got it. Got it.
And so if we can rule out and help them have a better insight on their lifestyle and what's happening, then it's a process of elimination. So if a person learns their trigger, for example, and they have medication, they can actually take the medication, and let's say the first trigger for some would be, the skin start itching. Usually the skin itches, then sweaty palm, and this is just a scenario I'm creating. Okay, skin itch, sweaty palm, maybe about 2 minutes after that, and then a kind of tension headache, 3 minutes after that, and so on, right? Now, if they learn the pattern, once the skin start itching, if they have medication, you put it under your tongue, you count to 10, and within about maybe 30 seconds or less, give and take, the rest of the symptoms don't come on.
Okay.
Okay?
All right.
And
So
under the tongue, go ahead.
okay, sorry to interrupt you, but
No, please.
based on your experience, how long does someone have to be on medication?
Okay,
I know you
it
say until they
depends.
reach a point, but
That they can manage. Okay.
Right.
It depends.
okay.
Okay. But initially, if someone does not have the insight to know about the triggers, it's best for them to be on the medication while they do therapy. So it's not medication and that's it.
Got it.
And especially if they want to not depend on medication, then they're going to have to take medication while they learn. It's like giving someone fish to eat. And while I'm training them to fish, they continue to eat until they can catch their own fish. Then I no longer feed them. Okay? So it's a similar principle. If they themselves can learn about the trigger, because the more we know, the better it is. And this is why we end up panicking, because we are uncertain about what's happening.
Yeah, I think so. Yeah.
We can actually follow our checklist in our mind. Once we learn about it, then we'll know what's happening. Just like how I highlighted the scenario. If you know the itchy skin comes first, then the sweaty palms a minute or two after, and then the semi-tension headache. Okay, we can actually intervene sooner. Some persons could just start doing breathing. Okay, that's deep breathing, hold it, count to 10. Some persons can start tensing their muscles, one muscle group at a time, releasing. Some persons can exercise in advance before. Okay, some persons take breaks if you're in a stressful situation. If you have not eaten and you're going nonstop, make sure you eat something so your body can sustain itself, so it doesn't go into distress. Because these are all possible triggers as well.
Okay. So we talk about the medication, we talk about the psychotherapy and stuff like that. We talk about prevention. So other than medication and therapy, are there any lifestyle remedies that could deal with persons could implement that could deal with panic attacks? That's my final question.
Yes, thank you. And I started jumping the gun by telling you that because yes, there are lifestyle changes that one can have. Earlier on, we highlighted some because we highlighted the risk factors. What is a risk factor is also a prevention intervention as well. And so for lifestyle, for example, if someone is accustomed to have panic attacks, right? but it has not reached the stage of panic disorder. If they're given a treatment protocol to follow, and treatment protocol, treatment plan could mean make sure you exercise, make sure you do your stretches, make sure that you eat on time because of your stressful job, make sure you take a break every 45 minutes to an hour, even if it means you stand, stretch, use the bathroom and come back, whatever it may be. Once they have a treatment and make sure if they go and see a therapist, etc., right? So that's one. Joining a support group of persons who would have experienced panic attack. At least there's something in common. And persons might be at different levels of their journey dealing with this. So they can share, just like how you highlighted.
But we don't have, right? We don't have any support groups in Turks and Caicos I'm not aware of. I mean, I guess we could form one.
Right, exactly. Because you see, when we use these kind of terms, people think it has to be this major technical thing. And no. Nowadays, if COVID has not taught us anything, is that we can just reach out, just like how we are right now.
Yeah.
We have the WhatsApp group. We have so many different social media that we use already. The platforms already exist. So we can utilize that. And all we got to do is start something. Sure. Hopefully, person seeing this that you're going to be posting on your channel can start coming together, linking up, okay? Because again, we are each other's keeper.
Yeah.
And so whatever it is that we can do, however we can help, that's it. Somebody somewhere would have experienced something similar and would have had a solution, at least a way to manage to help. So yeah, the support group. Again, avoid excess caffeine, definitely alcohol and other drugs, because alcohol is a drug. And according to the FDA and international standards, and we as a substance dependence prevention department, again, alcohol is classified as a depressant. Literally, when someone drinks alcohol, it numbs the central nervous system. If the central nervous system is numbed, it means the brain cannot carry out its function to the rest of the body. So that means the body starts slowing down. Mm-hmm. Okay? And even that itself is going to stop the free flow of all of our good hormones, even cortisol, which is supposed to be triggered to make sure we don't get into trouble, to make sure we don't get into accidents. This is why so many people, when they drink and drive, they get into accidents. They are too numbed, too relaxed. So even when the indicator, because nowadays they have this car to tell you when you're too close to something, even when those indicators go off, the person is already so out of their minds, especially if they also use other substances as well, that they're not going to be listening to the warnings. And then the body now would naturally go into, a panic moment to say, stop, watch out. No, the person ain't going to do that. And believe it or not, this is my observation based on the data. At least 95% of persons who get into accident after certain hours at night would have been under the influence of substances. And it's because their body was not in control of itself, but under the influence is why they could not avoid these accidents. Because, believe it or not, once the body registers something is happening, receive it through the eyes, through the ears, through the nose, it sends a trigger to the hypothalamus in the brain. The hypothalamus then sends another signal down to our adrenal gland and our cortisol resources to start dumping cortisol and adrenaline into our bloodstream to tell us, get ready to move, get ready to run, get ready to defend yourself. But guess what? When we drink, this signal is cut off from the brain. Because remember, it numbs our spinal cord. When we smoke, the same thing. Whether it be too much caffeine, too much nicotine, whether it be too much THC. Yeah. So this is what usually happens. So if we can avoid that, yes. If we can practice stress management and relaxation technique, yoga. I highlighted deep breathing earlier. Going to the gym, taking walks, even let's say going to the beach, chilling in the waters, just sitting, taking in nature. We always have this thing about sun, sand. What is it you say here?
Sun, sand, and beach?
Exactly, right? And not only that, but Turks and Caicos is like what, number 3, are in the top 3 in the world for beaches.
Well,
Right?
we're not actually, the results
Yeah,
came
number
out
1 now.
recently.
You're right. You're number
Yeah,
1.
you're number
Yes,
one.
that's right. But for
Yeah.
a long time, and not only that, but you guys also have, I think, you're in the top 3 in terms of beach in terms of white sand beach
Yeah,
because of the coral
for
makeup you
sure,
see and all that,
for
right?
sure.
And that's worldwide,
Yeah,
okay?
that's right.
And I'm saying that we have such natural resources, okay?
Mhm.
Why don't we utilize it? Because I'll say this, most persons who live in the Caribbean or the islands, we are less stressed than others elsewhere, you know. But when we start wanting to adapt the lifestyle of elsewhere, we forget where we are
That's true.
and we forget how beautiful we are
Mhm.
because of our nature.
Yeah,
Okay? So these are things that we need
yeah,
to capitalize on. And definitely, one of the things that most of us don't do is to get proper sleep. We may rest our head down, we may be in bed for 10 hours, but when we wake up, we feel as if we just finished running a marathon, we're not motivated, we're exhausted, we're tired. Why? Because we don't get quality sleep.
Mhm.
Okay? And many times we use substances that we shouldn't, such as what was discussed earlier,
Yeah,
alcohol, other drugs, to help us sleep. Why that is going to be a disruption? Remember, we talked about GABA earlier,
Mhm.
which is one of the brain hormones that helps to regulate the functioning of the brain. And if we use substances, then it's telling our body GABA is useless, which
Mhm.
is responsible for helping to regulate all of our brain waves during the night, which would help in the 2 sleep cycles. We have the non-REM sleep that happens when we hit the pillow. If we stay hit the pillow on the pillow and we stay snoozing,
Mhm.
an hour and a half after that is when we go into REM sleep. REM sleep is important because that is when the body re-regulates itself,
Okay.
and that is when it helps our brain to be more focused, more efficient. We can remember, we can recall, we can think on our feet, we can just name it.
Yeah.
Okay, our mental health would be
Yeah, like in the
optimal.
sound mind. Mhm.
Exactly. However, if that does not happen because of disruption of everything else we talked about, we will have mental health challenges,
Mhm.
including a triggering for panic attacks.
Interesting. Now, I tell you this, for me, the last time I was about to experience it, because I felt it coming on me,
Mm-hmm.
while I was at dialysis, and the nurse said, Draxel, relax, relax. And so I told my mind, Draxel, relax, relax, relax. It's not coming, it's not coming. And then it didn't happen,
Of
you
course.
know, because before I just accepted it coming on me.
Mm-hmm.
And after then the nurse say, relax. I said, oh, that's it. Relax,
Mm-hmm.
relax. And so
And
that's a very,
you see what you did? Self-talk. That's it.
yes, yes,
Again, talk.
mhm,
Okay?
yes,
Talk therapy.
yes,
Talk.
yeah.
Yourself
Um,
talking? Yes.
Now, just a quick question though. Is palpitations a um, family to panic attacks?
Well, okay. Palpitation is raised heartbeat. Okay? I
Uh-huh.
start bouncing, as if, and that could happen because one, someone is tired, as in exhausted from over stressing of something. It could happen if you just finish running an intense marathon or intense 100 meters, or let's say the dog chase you, right? And you have to scamper because you didn't want to be bitten by the dog. And mind you, that is as a result of the adrenaline and cortisol kicking in, and your body is just rocketing past whatever. And you never even know you had that speed in you. Of course, when you stop, you're going to stop suddenly. And so it's going to be like, that be classified as palpitation. But all things considered, because remember I said that in the fight and flight syndrome as well, panic attack usually happens as well.
Yeah.
And it happens because of the circumstance where your body has to prepare itself to take off or defend itself.
Okay.
Okay.
All right.
So,
well, Dr. Prince, I don't know if you have any closing remarks, but do you have any closing remarks?
Well, I just want to say thank you for having me, and it really was a good experience.
Yeah.
Which I was expecting anyway, knowing who you are and how you are.
Okay.
And hopefully some cycle around again that, you know, we can have another talk about another topic.
Yes.
So just let me know, you know, my policy and protocol now.
Yeah.
And so just let me know, let us know. And I'm not the only one to do stuff. We have others here who can do. I know you know Dr. Anya Malcolm because it's through her why you came to me.
Yes, she recommended.
Exactly. So there are things that she will do where children are concerned and so on. And this is me getting her back. Okay. So I told her that yesterday in our meeting, you know, that we were having this. And thanks to you, Dr. Anya Malcolm. So yes, we do have fun here. And if nobody knows where we are and who we are, it's because they do not want to know.
Okay.
I'm telling you that. And mind you, a lot of times, again, big words are used, things are used. Because for someone to say, oh, I didn't know you have a mental health and substance abuse dependence department, that's a lot of words. However, if you were to say to them, oh, you don't know Dr. Anya? Oh, yeah, she does this. Yeah, man, I know her. Of course they do. Do you know the bald-headed guy? Oh, you mean Dr. Prince? Yeah, of course I do.
Yeah.
But once you associate us with the whole big title, some person may say, what? Where is that? Oh, you mean the drug council down at Sam Harvey's place? Because he used to be the drug council. Oh, you mean where immigration used to be and the hole in cell? Yes, right here.
Okay.
So they do know where we are.
Yes.
And they do know we exist, but sometimes just the words and not the person can distract them from knowing.
True. Well, thanks again. And you've been watching the Drexel SEMA show. I really enjoyed this conversation. Sometimes it's embarrassing talking about certain issues in your life, but sometimes you just can't keep those things to yourself. And so I'm glad that we're able to talk about panic attacks. That's something that I've experienced. I haven't experienced for a while. But so I'm glad that this has been a very informed conversation. Of those of you, it's not just about me anyway. It's about using this platform to help others overcome anything they have in their lives and to inspire them, to encourage them, and to influence them. So thank you again for watching the Drexel SEMA show. Thank you, Dr.
You're welcome, Mr. Simon. Thank you for having me.
Thank you.
And good luck with your show. What I've seen, I know you're doing wonders. So I know you'll continue to do wonders as well. And let us know how we can help you make your wonders continue and make it happen.
Thank you.
Rise up, rise up.